This is Theodore at Lies of the Devil. Go to liesofthedevil.com, where we're at the front line in a spiritual warfare to point out satanic propaganda and lead people back to Jesus Christ, the real Jesus Christ, not the New Age pagan Jesus Christ that's in the shack. I want to talk about healthcare, Trump's healthcare bill. This is Spiritual Warfare 101. Satan loves fear and loves confusion. He loves that. So, and this whole fake news and all this, people constantly just wanting content shoved down their throats, whether or not it's real or not. Trump just said, hey, I love this new healthcare bill that we're about to pass. Great. You've got the Democrats who are hating it. I wonder why they hate it. Okay, if it's not Obamacare. So you got the Democrats who hate it. Then you got top Republicans, rhinos, the people that are part of the establishment that hate it as well. And then you got another portion that this is great. This is a good start. So what's really going on here? We're going to look at a gentleman, Representative Nunes, who came out to talk about healthcare, and now that he's being bombarded with questions on Russia wiretapping and stuff. We're going to go to Fox News here and just show you, it's not even about the real issues. It's not really about, it's about fear-mongering.
Public hearings, and we may be adding to that list.
So when you say we don't have evidence, you really don't have evidence, period, in many areas, right? You're just beginning this stage of investigation.
Yeah, I mean, look, we know where, in terms of the body of evidence that went into the report that Director Clapper produced
now it's all
in the middle
Russia
of January before the inauguration.
About healthcare, which was
we have an agreement on that.
Supposed to be happening.
So that's I think we're close to an on where that information will be housed and who will have access to it. So I think we're set there. We've sent a series of other questions and letters to DNI, FBI, and other agencies to see to ask for additional evidence that we are.
So this whole thing, this whole hoorah about healthcare is pushed under the rug. Now they're talking about this. Now they're talking about Russia wiretapping and the whole 9 yards, and just trying to cause hysteria. Okay, Steve Bannon came out like not too long ago and said on his Twitter or something like that, and said, listen, by the end of Trump's presidency, he wouldn't be surprised if lots of Obama's administration, including himself, be put in federal prison. Okay, we're just gonna go into the news, and we're gonna talk about what's really happening with this whole Trump healthcare bill. You got NSA whistleblower backs Trump on wiretap claims. Okay, this is NSA, and part of the intelligence community backing Trump. So, let's just move on from that. Okay, we did a video on that. So you got conservative review, and a lot of these companies like Conservative Review, I don't know too much about them, but a lot of these like Fox News, even in a lot of ways, they have a bunch of liberals that are running an operation. Okay, and they might be doing a good job, but the GOP bill is actually worse than Obamacare for two reasons. It will exacerbate the death spiral of fiscal insolvency and will destroy the employer market. Now, we're going to get into what the healthcare bill is about. And, Obamacare was such a mess, such a huge mess. My grandparents that had great healthcare, and they were all for Obamacare, they were just all for it. When it actually was enacted, after 6 years, they were like, let's get rid of this thing. Their premium shot up the roof, their drug costs, the whole thing is just a mess. So now you've got these people that have implemented a plan. Okay, these socialists, they've implemented a plan. Costs are going up through the roof. Companies can't hire full-time people anymore. They have to cut down to part-time to try to save costs. You have a huge economic program that is disrupting the economy. What are you going to do? Conservatives would say, hey, listen, I'm sorry, conservatives can be very heartless sometimes. They would pull the rug from underneath it, say, repeal the whole thing, get rid of it, and let's start new. Well, you do that, you're going to leave a lot of people that need insurance off the back of taxpayers, okay? Believe me, I don't necessarily agree with that, but it is what it is. Sometimes, we need to take care of the poor, but people that need this insurance, they've got operations already going on. They're already stuck in a drug system or whatever the case is being. They're already hooked into the health insurance economy. You don't want to pull the rug from underneath them. It would hurt some people. So what do you have to do? Economics 101. Sometimes for a smooth transition, you have to implement economic programs that will help feed this beast, if you want to call it, to slowly weed the people off of it. Even drug dealers know this. Somebody gets hooked on crack, you only give them a little bit. You can't give them a lot because they'll OD. Okay? So it's the same thing with socialist programs. You can't just get somebody off of crack. They'll go through, pains and trying to, sickness, because you took away their drug, and you can't give them too much or they'll die. So, this whole plan it's basically feeding a crack dealer. It's a crack program, okay? This Obama Care thing. So we're going to go to an actual article from a pharmaceutical company that will actually tell you what is going on with the bill, so people can calm down a little bit, okay? Pharmaceutical Love or Live. And here we go. House Republicans on Monday will unveil a healthcare legislation that will eliminate the requirement that most Americans obtain medical insurance and create a system of tax credits to coerce people to purchase private insurance on the open market. I'll be quite honest with you. If Trump, who says that he's going to do a huge tax cut, you know what? I wouldn't mind. I think that that's a good thing. We're not required to pay insurance, but they're going to give us a huge tax cut if we were to go buy insurance. I don't see anything wrong with that. Now, I don't believe the government should be involved in the economy as much as it has been. But there's nothing wrong with giving people the money to do what they want. And if health insurance is one of those incentives, what's wrong with that? Now, here's the big thing. This is the really good thing here. I go to Mexico to get, medicine sometimes. You can get inhaler. I haven't have asthma. I used to. Sometimes I have it every once in a while. You just pay like 20, 30, $50 for an inhaler, okay? $50 for an inhaler if you don't have insurance. And, another 50, 60, $70, whatever, for antibiotics for like 10, 20, 50 pills. You go to Mexico, it costs like $3 for an inhaler and $5 for a big thing of antibiotics. Oh, but in America, if it costs $100 for, $50 for an albuterol inhaler, if you get insurance, they'll give you a nice discount. And you might get it for $10. Okay? I mean, it's insane. It's totally insane. So what they're going to do is Trump, who has previously called for lower drug prices, added, "I am working on a new system where there will be a competition in the drug industry. Pricing for the American people will come way down." He gave no details. His comment sent shares of drug makers lower. Shares of Pfizer, Merck, Co., Amgen. Now, if you have these insiders, listen, people, it's a very easy thing. There's insiders in politics, big time insiders, and they will actually, how should I say this? They will play the market according to whatever legislation is going to get passed. And if you've got Pfizer and all these people, all of a sudden their shares are dropping, it's probably accurate to say that Trump is going to slash drug prices. Okay, they've got people tucked away inside the halls of Congress and White House that know what's going on. That's why the NASDAQ and all these industries, that it's like a big pot of industry, these NASDAQ and whatnot, they have, why it's going through the roof is because you have a pool of these different industries that know the regulations that are going to get cut, and they're investing heavily in the stock market right now. And then you're going to have other sectors like these drug companies who are going to tell you that, hey, listen, a pool of companies, a pool in the stock market is different than independent companies that are involved in Wall Street. So the pool in itself shows you, hey, that the economy is probably going to do very well here in a little bit. Okay. And then you've got drug companies who are saying, okay, hey, the shares are dropping down because, listen, they know that's coming down the pipeline. So anyway, people, just to reiterate, there's going to be no requirement for Americans to get insurance. Now, I hope I'm right on this. Okay, according to this article, what they're saying, insiders, There's not going to be requirement on health insurance for most Americans, okay? And they're going to cut down drug prices, and they're going to have to put more taxpayer money into certain programs to level out the crack program, okay, what I said earlier, to make sure that it's not too much and it's not too little, okay? And there's going to be a big tax cut on the way. And he's already slashing the budget in order to give to different programs so that, taxpayers aren't having to, pay more and more and more and more and more. So anyway, just calm down. Everything's okay.